Welcome back to the show. February is Heart Month, and I am talking to the renowned cardiovascular disease physician, Dr. Thierry Momplaisir. Dr. Momplaisir, we were talking about what causes a heart attack. How do you fix it?
Well, the treatment of a heart attack actually begins with the patient. First, understanding and recognizing the signs and symptoms of a heart attack and calling 911 for help. Here at Our Lady of Lourdes Medical Center, we have one of the largest cardiovascular program in South Jersey. We do more hearts than anybody in this area, and our focus has always been to improve the quality and also to improve the time it takes us to open up that artery. Because once you have a heart attack, the blood flow to that part of the heart stops, and that part of the heart muscle actually begins to die. And I have a slogan that I tell to my patient: time is muscle and muscle is life. So the longer it takes for us to open up that artery, the higher likelihood this patient has to die from a heart attack. So the way we actually treat the heart attack, it starts with first our ER physician making the diagnosis that this patient is having a heart attack and activating the cath lab staff, which once we come in, we can actually get the vessel open under 60 minutes. That's our goal at Our Lady of Lourdes Medical Center. We can access the heart by going either to the groin or to the wrist. I actually studied the radio program at my hospital where we do a lot of procedure going to the wrist. We can get to the heart that way, and once we perform the procedure called coronary angiography that helps visualize all the arteries and actually localize the artery that's occluded. And we use special wires and balloon to open up that artery and place a stent. We can get all that done under 60 minutes.
Now that 60-minute time frame, is that unusual?
Well, it is, because currently the national standard is 90 minutes. There's something called door to balloon time, and if you look at the national standard, most of the hospitals strive to achieve that under 90 minutes. The reason why at Our Lady of Lourdes our goal has always been to improve that number is because we have such a high volume. We have a very experienced staff, starting with our ER physician and our cath lab staffs. And because of that, we feel that it becomes absolutely necessary to improve the time it takes, because that 30 minutes can make a difference between someone living or dying from a heart attack.
Now, what can you do to control those risk factors?
Well, first, again, is having a primary care physician. I have to stress that, very important, because a lot...
Okay, so you're the specialist.
Yes. I'm an interventional cardiologist.
Okay.
And I'm also a general cardiologist, but I did practice internal medicine, but I'm not a primary care physician. Mm-hmm. So the primary care physician play a critical role in the patient care because they are the gatekeeper. They are the ones seeing the patient for the first time. A lot of patients that I see in the hospital, they are seeing a physician for the first time when they have a heart attack or when they have kidney failure. And that's where the problem we have in this country. We need to improve access to care. And that's one of the reasons why one of my focus, believe it or not, as an interventional cardiologist, is to also improve access to care, especially in the underserved community. Myself and my partner, Dr. Troy Rendo, we started a program called Close the Gap. And the goal of the program is really improving access to care in the underserved community. Because if you look at the prevalence of heart disease, it is extremely high in those populations, the Hispanics and the African American population. And part of the reason is because those risk factors that I mentioned are extremely high. And a lot of these patients often don't have a primary care physician.
So it has a lot to do with diet, with exercise, and with what are some other, smoking? So
first thing, diet and exercise. I always tell patients, it's a team effort. What I can do as a physician is prescribe medication. But when we look at the risk factor for heart disease, lack of exercise is a risk factor, obesity is a risk factor, diet, and often patients tell me—
And high blood pressure.
Yes, and high blood pressure. Often patients tell me dieting is very challenging. However, if you, with proper education, you can educate these patients and the proper diet and exercise, smoking cessation, and stress management. Believe it or not, stress is a significant risk factor. It's what we call one of the silent risk factors that we have no magic pill for. But exercising helps with relieve stress.
So we're talking about making sure that you take control of your body and your mind and your spirit so that you won't have to endure a heart attack and heart disease.
Absolutely.
In the long run.
Absolutely.
Now, when we come back, we'll hear from the brave woman whose life was saved after suffering a heart attack. Yvette Samuels joins the doctor to share her unbelievable story. That's next.